Time to get into our final discussion today. Remember, we still have book review coming up, so do stay tuned for that. But it's all about fighting cancer, and we'll be talking about two rare types of cancer and also the efforts that are going to sensitize and inform the public about the same. In studio joining me today is Omar Abdi Aden, who's from Henzo, Kenya, and also a CML patient. Thank you very much. And Ben Wahome, an events coordinator and administrator, Wills of Africa. And you'll be telling us how Wills of Africa is coming into this, yeah? Yes. So I'll start with you, Aiden, and talk to us about what Henzo Kenya is.
Henzo Kenya is an organization, a social organization of people who are suffering from leukemia. Okay. That is chronic myeloid leukemia. And they came together to help the other sick people. And then to sensitize our plight. Okay. Yeah. Most of the people are either sick or caregivers or spouses. They came together so that we can be to help each other.
All right. Yes. And you talk about sensitizing people. What are they? When you talk about a CML patient, what is that?
That is cancer of the blood. Okay. That is it. Yeah, there are two thoughts of school. There is the old one that says that your bone marrow malfunctions and then start producing defective cells, which most of it is white cells. In the end, it destroys you. And the new thoughts of school nowadays is that it is an environmental disease. When you destroy the environment, then leukemia knocks at the door. Yes. Okay.
And there's the CML and GIST as well.
Okay, GIST is a stomach cancer. Also, we are grouped together because we use the same medicine, Glyvec. Okay. This Glyvec, it is the new medicine that gives us life. Okay. It is no longer a death sentence. Nowadays, you can live a long life and die with another disease. All right. Not leukemia.
All right. You'll take us through some for you when you found out and how that was like. Yes. Let's come to you, Wahome, and how is Wills of Africa involved in this? And what do you know about these two conditions?
Thank you very much. Wills of Africa is a cycling organization based in Nairobi, Kenya. And how we've partnered or how we've collaborated with Henzo, this is our third year in doing this. We are encouraging healthy living. And as Wills of Africa, what we do is we promote and we encourage cycling. Cycling being one of the ways to live healthy, to exercise and to make sure that our bodies are always right. Yeah. And thus we collaborate with them to give them hope and strength that there's hope. It's not a death sentence once you have cancer, but you live healthy and you cycle every day. At least you push for your life.
Yeah, so one of those healthy living regimes you're pushing out there.
Cycling.
Yeah, sure. All right, Abdi, take us through when you first found out you had this cancer. When was that?
It was 2005, September. I was sick for some time. I was being diagnosed with other diseases. And then later on, I went for full checkup. And then they found out I have leukemia. At first, before they found out I was getting weak, I thought that my time was over. Until the day I was diagnosed and I was put in the program, Glyvec program. Within a month, I was back to normal, and I could go to work. So I thank Novartis for doing the research. Yes. Otherwise, I would not have been here. Yes. And also I thank Max Foundation that gives us the medicine, because we cannot buy this medicine. Okay. This medicine we are given free of charge.
Yeah, that's what actually I was going to ask you about the medicine. How accessible is it?
Yeah, it is given free of charge through Max Foundation. Max Foundation, they made the foundation because their son, who was 17-year-old, died of leukemia. At that time, there was not, this medicine wasn't there. But they decided to put a foundation to help third world countries. We cannot afford the medicine. For me, it is 600,000 a month. Wow. Yeah, even if I was a billionaire, I would not afford it. So they give us and they talk to Novartis, who manufacture this medicine, and they give us. Okay.
Would you say, Wahome, if I don't know how much of the information you know in terms of the two conditions, how much information also is out there for the public to be able to access the medication, and that this you can still live a normal life?
I'll tell you this. Information has not been well dispersed to the people. Right. And that's as a cycling organization promoting healthy living, we've collaborated with them for 3 years, as I told you, to try and push this message out, because very few people know about the medications. Very few people have been know their status, know their health statuses regarding cancer. So it's the reason you're coming out, having cycling events that will encourage, that will call people to come and attend such events where they get more, they get to learn, they get to receive the information, they get to know and to interact with people, survivors and patients and caregivers, so that in the long run, at the end of the day, people are well educated regarding cancer. They know where to go, they know where to get the medicine. Yeah.
Okay, and Aidan, the two cancers, we're not talking of course about all of them, it's these two particular types. It's not curable, but it's manageable?
First, for GIST, it is also curable.
Which one?
The GIST.
The GIST, okay.
And now at this particular present time, even the CML is curable.
Okay. Because
there are new medicine that says that and leukemia patients, some of them have become totally leukemia free. There are new medicine now. We are using the first generation medicine, and now there is a third generation medicine that fights specifically the defective cells. So they think that in the near future it will become just like malaria. You will have CML, but it won't affect you. It won't kill you.
Yeah.
Yes.
Okay.
And it can be expunged from your body.
Yeah.
Yes.
And I'll ask you the same thing I've asked them. With the people you've been able to interact with, is the information out there? Do people understand when they have these two particular types of cancer, where they can get the support and the help?
That is what we are trying to sensitize.
Okay.
Because some people this is silent killer. You get it, you don't know it until it puts you down.
Right.
So that is what we are trying to sensitize the people to know, that there is this disease.
Yes.
This disease was not there before. That is why they call it rare. Before, you have to be near radiation, somewhere where there is nuclear radiation. Then you have leukemia. But now it is prevalent. Before, people, even if they get leukemia, they die before anyone knows what it is. But now there's the medicine. And there are the doctors who can diagnose it properly, and then your blood is checked, and you can be given medicine to survive.
Okay.
Yeah.
And we'll talk about more of the event, Wahome, in terms of what's happening this Saturday. But you said this is the third time you're involved in this work.
Yes.
So how successful, or how the impact you've managed to have in the last two occasions you've been involved?
We've created much impact, I would say, from Hands of Kenya, the response from them. They've actually added to their database the number of people who've joined Hands of Kenya. And we've also seen from previous cycling events, people coming out. This year, the registration and those who willing to come can be seen. The numbers have really gone up.
Yeah.
Information is really out there with the people.
Okay.
Yeah.
All right. And talking of the people who have gotten to know about this, how are the numbers right now in terms even of those affected by these two cancers, and those who know and those who you perceive don't?
Actually, we cannot tell.
Yeah.
It is people who know, they don't register to say that they know.
Okay.
So we can't tell how many people know.
Yeah. But how many are in the organization, Hands On?
About 500.
Okay.
Yeah. But most of the people are caregivers and people who are afflicted. So for general public, we can't say, because even if they come, they don't register to say that we are aware of it. That is why we want it to be out in the open, and that when somebody is diagnosed with this disease, he doesn't panic.
Why do you think people panic or decide to just go all close back on this and not talk about it?
Because in the beginning, first of all, when you are diagnosed with cancer, you are in shock.
Yeah.
And then when you are diagnosed with blood cancer, you see, you are in an even greater shock.
Yes.
And this is the lesser cancer, it's not the big cancer.
Yeah.
Breast cancer and all these other cancer are more
aggressive.
This one is something that is not so bad. But once you are told that it is your blood, so your imagination comes into play. You imagine that your blood is going to your brain. Your blood is going to your heart, your lungs, everywhere. So every part of your body is going to be affected. So it is a big shock. So you want to sensitize the people that it is nothing. You have the cells, the red cells and the white cells. You had them before. Only now they are defective. They can only kill you if the white cells outnumber the red cells by a greater number.
Okay.
Yes.
All right. So as we wind up, Henzo Kenya and Wheels of Africa, is it?
Yes.
Yes, Wheels of Africa coming together for this cycling event this Saturday. So take our viewers through. If you want to participate, how do you do that? Where is it going to be happening? Are there charges?
Yes.
Yeah.
The event will be at the Railway Sports Club next to Uhuru Park on the 16th of November. That's this Saturday. And we've lined up a couple of activities. There will be a main race that will, the cyclists will have to cover 60 kilometers. Do you have to the route?
Yeah, it's 60 kilometers to where?
60 kilometers. Within Nairobi County, we will have, we start from Haile Selassie, Mombasa Road. Then at Cabanas, we branch into the Eastern Bypass, up to the new superhighway, then back to Pangani, the underpass into Forest Road, from Forest Road, Uhuru Highway to Kenyatta Avenue, back to Railway Sports Club.
60 kilometers?
60 kilometers.
That will be 60? Yeah. It sounds very...
From our mapping, yes, it's 60. Yeah.
Okay. So they have to come with their bikes, or how does that work?
As Wheels of Africa, we have bikes. We'll provide bikes for hire for those who won't have bikes.
How much?
1,000 bob per bike. And for kids, we'll also have bikes for kids and adults. Other than the main race, we also have some other fun race. We'll have relays for kids. We'll have bouncing castles. We'll have other races for kids, shorter races. We'll also have a fun ride where we want to cover around 30 kilometers or 15 to 30 kilometers. That's within the Ngong Road, or Leodume Road, or Tok Road, to Raptor Road, Westlands, or Highway, Kenyatta Avenue, back to Railway Sports Club. Okay. And we'll also create an avenue for people to learn about cancer. Yeah. Come and interact with people. Come and share your story. Come and open up to the world. Yeah. Let's kill the stigma.
Okay. So are there charges?
Yeah, a registration charge of 1,000 only, and you get a free T-shirt.
Okay. Our story, it's written our story.
Our story.
Cycling to stomp out cancer. Stomp out cancer. Okay.
Yes, and you can do the registration online. We've created a portal, Henzo Kenya website. Yes. You can register there, or you may come to our offices in Spring Valley Westlands. Okay. Come get a T-shirt and a form, and you'll be done. You'll be good for the event.
You'll be good for. So it's 1,000 shillings.
1,000
Do you have
shillings,
a close date deadline?
No, we open. We open till the event.
Yeah. So even at the day for the event, somebody can come and pay and be part of.
Yeah, at around 7:30 a.m.
Okay.
Be there, and we'll register you, and you'll enjoy cycling with us and learn about cancer and support them.
So as you do this cycling finally with you, as you go around and all these activities you'll be doing through that day, that is how in essence you want people to start asking questions. Okay, what is this about? And then that awareness then is raised.
Yes. We want to be done in our T-shirts, in the Henzo T-shirts, create the awareness, create the zeal and the urge for people to learn.
Okay. Yeah. All right. Finally, Aiden, as we wind up with you as well, how many years has it been, you said, since you got this?
So this is my 8 years.
Eighth year.
Yeah.
Okay, 8 years, it's not a short time. That is a long time.
Yeah.
How would you say it has been for you to live with this, the challenges you have faced, and what you tell other people who perhaps are watching this and not part of Henzo?
I think that I live a lot more healthier life than before. Yeah. Yes. Because suddenly I'm aware of my body and I take good care of my health. Yeah. So that this disease actually sensitized me into knowing my body and how to live healthy. Okay. So actually I feel that I fulfilled my life. Okay. Okay, you being sick is not a good thing. Yes. But once you have got it, it is psychologically you should make it. You should not let it affect you. Yeah. And then you take good care of your body now and your health. You can live long.
Okay.
Yes.
You want to say something, Fanny?
Yes, I want to say something before we close. this is a call also to people to come out. There will be lots of prizes to be won, lots of activities to engage oneself in, and an opportunity also to spread the word.
All right, to spread the word indeed about these two rare forms of cancer, CML and GIST, if you like. So it's all happening this Saturday at the railway grounds. Yes, this Saturday. It's 1,000 shillings for registration. You can be part of that. It is indeed a good cause. 8:31 a.m. We take a short break now. We have book reviews still coming up, so stay with Morning Express.